Now, for your second question, you have asked about how we have handled SEANUTS II, and with the COVID situation in Malaysia, this slide is basically just showing us how the situation has been, and right now we are actually in the third wave. Movement control order started on the 18th of March in Malaysia. We are in third wave, and at this point in November, when I took this slide, it's about 58,000 cases. But as of yesterday, the number of cases is close to around 120,000, because in the last couple of weeks, we have had more than 2,000 cases per day. The situation in Malaysia is getting more and more serious. But our movement control order have relaxed somewhat, mostly also due to the low-income families not being able to get any income if they are not allowed to go out to work. And partly because of that, we are seeing a bad rise or a big rise in COVID cases in Malaysia. Now, how has that impacted SEANUTS? So this slide is just showing about what are the measurements that we are doing for SEANUTS, and we started SEANUTS data collection in April of 2019, and we were supposed to end the data collection in August last year, but we had to stop data collection when the movement control order started. So here you can see a lot of the measurements that we are doing actually involves physical contact with the children, like we have to measure anthropometry, and then we have to take blood and do blood pressure measurements. And we also ask the children, especially the school-age children, to do their fitness tests. So in the situation of COVID movement control order, we would not be able to do fitness tests because children are not allowed outside their schools to run and so on. However, before the movement control order started in the beginning of 2020, we were actually in the last region of Peninsular Malaysia for our data collection, and that is in Negeri Sembilan and Johor. That was from January to March, and we actually finished data collection in Peninsular Malaysia just about a week before the movement control order began. So we are quite lucky in that sense. And because of the COVID situation already existing then, people are already more cautious, including our own SEANUTS team. So for data collection, we actually put in place some strategies where we will reduce the chances of spreading COVID-19. Okay, so basically for our team, we make sure that they take care of their personal hygiene. If the researchers are not feeling well, we don't know what's the cause, we just quarantine them, and they have to wear masks and use hand sanitization when they go out for data collection, even at that point in time before MCO and the situation got serious. During data collection also, we had to make sure that there are social distancing measures being taken into account. So we have to get a bigger room, or if the school does not allow us a bigger room because they just don't have bigger rooms, then we get less children to come in for each session of data collection. We also make sure that we have like our masks and hand sanitizers and so on prepared. And at that point in time, because we were already out data collection since January, by February we managed to get some of these supplies in place. So we were quite safe in that sense. And last of all, one more thing is, if the child is sick on the day that we are there to do data collection, we will not take them for data collection. So what we will do is actually we will communicate with the parents beforehand to confirm that their child is all right. If their child is all right and not sick or having fever or anything, then they will join the data collection on that day. So these were the steps that we had to take in order to be sure that the SEANUTS data collection team does not become a spreader of COVID-19. And indeed, we were lucky, we were safe, and nothing bad happened for our data collection. So immediately after we finished data collection in the southern region of Peninsular Malaysia, we decided to halt data collection for Sabah and Sarawak because of the rising cases of COVID at that time, and then the MCO started. In the beginning, we were still hoping to go to Sabah and Sarawak, but after observing the situation, when it came to around August and situation was not really getting better, we decided along with our counterparts in FrieslandCampina to discontinue data collection for Sabah and Sarawak. So that is something that's very unfortunate, but we are glad that we made that decision in August, because by October, the COVID situation became worse again, and today in January, we are really quite bad now. Okay, and because of that, SEANUTS II data for Malaysia will now only represent children in Peninsular Malaysia. We will not have data for Sabah and Sarawak. COVID-19 has also made everything become a little bit slower due to the movement restriction in the beginning, especially our research assistants and enumerators who were also doing data collection, and they were supposed to be doing data entry. They couldn't come back to campus to collect all the files and so on, and because of that, data management is taking longer as well. So this was some of the consequences of COVID in relation to our SEANUTS II research project. However, on the positive side, we also quickly took note that opportunities can arise with the COVID-19 and lockdown situation as well. So around towards the end of April, May, at that time, we decided that we should do a sub-study to see how COVID-19 has impacted our children's lifestyle behavior. And in this case, the SEANUTS sub-study for COVID-19 is, we are quite lucky, because what we did was we contacted back the children who have been participating in our baseline SEANUTS data over the past year, and got their permission, the parents' permission, and cooperation to participate in the COVID-19 sub-study. So we actually do have data before and during COVID-19 for comparison. I know a lot of studies on COVID-19 have started over the past 1 year or so, but many of the data that people are collecting, especially the surveys, including the UNICEF one, it is, how to say, it is like just the data for COVID. You have no comparison from before that. Okay, so for the COVID-19 sub-study, what we did was actually we looked back at food insecurity, child food habits, has it changed? Physical activity, has it changed? How about their sleep pattern, did it change? And also some general questions that are related to the COVID-19 pandemic itself. I would also like to acknowledge my SEANUTS II team. So this picture here actually is in our library, and not all the team members were there, because then it would be more people. So this picture was taken pre-COVID, and they have worked very hard for the project, so we really appreciate that. Okay, and we also would like to acknowledge, of course, all the children and the schools and everyone involved in the project. With that, I would like to thank you for giving me this opportunity to do some sharing on the FrieslandCampina Institute platform. Thank you.